All right, so today we're going to be going over demonstrating how to check a blood glucose. So your diabetic patients have to usually have a glucometer and check their blood glucose, usually based on a schedule that their physician provides, whether it's twice a day, before each meal, and at bedtime. So I'm going to go over and demonstrate how we would check that. Supplies that you would need is obviously a glucometer. Most diabetics get this through their insurance. You would also need test strips that go along with that specific glucometer. You would need a lancet. Now these are really important because this is how you're going to actually draw the blood. Important to tell your diabetic patients is that they need to use a new lancet every time they draw blood. So they should have quite a few of these, okay? You will also need an alcohol swab and then a 2x4 or a 2x2, I'm sorry. Or if they're at home for their patients, either a tissue or paper towel or whatever they want to use. So one thing we want to talk about here is to make sure that their glucometer is up to quality. So usually they need to do a quality control check on their glucometer. If you're in the hospital setting, it's going to be every 12 hours. If they're at home, it's whenever they feel like their glucometer is not working appropriately or when they change test strips. So the way that we would actually do this is they would use an alcohol swab to prep the fingers, okay? More importantly, they need to wash their hands first, so you would always tell the patient to wash their hands. You would also want to warm it up. You can start by either rubbing the fingers together, using warm water, or and then you would want to, after washing their hands, alcohol swab the finger, okay? They can change different fingers. Most importantly is you want to, and you would twist the lancet off and pull, okay, is to use the side of the fingers. They have less nerves on the side of their fingers than on the pads of their fingers. So you would ask them to press the side, push this in, and click it, okay? Once they draw the blood, they would take their paper towel, or if you're in the hospital, a 2x2, and wipe away the first drop of blood, because we're not going to use that. You would then, again, kind of gently press it, and the test strip should already be in the glucometer at this time. You would take the test strip out and get a little bit of that blood in the glucometer, and then it would proceed to give you that number. And that's how you would check a blood glucose.